Welcome to In the News with Double O Des. I'm Des Bernardo, giving you my perspective on news from South Africa and the rest of the world. In the news now is a story that will probably make your blood boil. And it is something that most people would fear unless they actually understand the master plan behind what our government is doing to this country currently. And of course, it's from our famous news site News 24, who is the government propaganda piece. And the headline reads, COVID-19, another hard lockdown possible as SA prepares for spike in deaths, says Mkhize. Now we know that they are used to fear-mongering, making people fear, and they say this the moment that they want people to abide by their regulations, because remember, they are not laws, they are mere regulations, and they are not level 1 offences. So you cannot be arrested for them, and the court has spoken on that. Health Minister Mkhize warned that another hard lockdown could be considered if the situation warrants it. The minister is especially concerned about Gauteng, which is experiencing a surge in infections. People need to adhere to safety protocols, he warned. You see, this is all they want. They want people to adhere to what they have to say. Does he think that people will abide by any more hard lockdowns? Well, he should try it to actually see what the people do. Health Minister Mkhize has warned that South Africa is on the verge of facing a spike in coronavirus cases. He must have his glass ball in front of him. And related deaths, which means another hard lockdown may become necessary. Speaking to Talk Radio 702 morning host Bongani Bingwa on Tuesday, Mkhize said things were getting tough. They said that in March already. I wish I could say otherwise. We have warned that the surge will come, especially in the winter months. I'm afraid the numbers are increasing and we need people to be aware and take all the necessary precautions to try and protect themselves. Mkhize said the infection rate in Gauteng in particular had increased faster than had been anticipated. Well, at this stage, everything had actually come slower than their predictive models had anticipated. So, in relation to what is he actually saying this? He added that the so-called hard lockdown level 5 had helped prepare the healthcare sector for the anticipated surge in infections. So why is there a concern now? Why has he got a concern if they prepared? Then let the people go to hospital. We're all going to end up getting the virus in any case. While he acknowledged that government could not extend the hard lockdown longer than it did, we may still do it in the future. Fear-mongering. This is like someone standing with a whip saying, if you don't do this, I'm going to crack this whip behind you. But if you crack the whip enough, someone gets used to the lashes and it doesn't hurt them anymore. While he acknowledged that government could not extend the hard lockdown longer, it did. We may still do it in future. Fear-mongering. But people needed to get back to work and go about their normal lives, Mkhize said. We are trying to balance these two. We need utmost cooperation as we go about it. Now, this is absolute buffoonery. Does he actually understand what he is saying? I really doubt it. Is he even a proper medical doctor? I actually wonder. I haven't researched that, in fact. He seemed very insignificant in the big scheme of things. According to Masuku, the Gauteng provincial government may possibly look at intermittent lockdowns. What does that mean? Intermittent lockdowns. As the province prepared for a peak in COVID-19 cases. Now, Cape Town was the hot spot. We had now reached our peak in this week, according to Alan Windy, and there was no intermittent, nothing. The people are doing what they want. They really don't care anymore about what the government is saying. They have made the decision. The government can't do anything about it, or they're going to lock everyone up. We are the government. They forget that. Intermittent lockdowns would see the province opening up and then closing the economy for a particular period of time, Masuku told News 24 on Monday. Mkhize said the number of infections in Gauteng had been rising sharply since the beginning of June, much more so than in the Western Cape, the country's hotspot of coronavirus infections. By Monday, the Western Cape had a total of 60,455 cases and Gauteng 39,841, but it was catching up to the mother city and at a rapid rate. What on earth has the one got to do with the other? Really? On Sunday, Mkhize said Gauteng would emerge with the highest number of cases in the coming days, overtaking the Western Cape. So what? There's more people living there. Stay safe. On Tuesday, he pleaded with South Africans to adhere to health protocols such as wearing face masks, social distancing and washing hands. Wearing a face mask is not a health protocol at all. There's very basic things that a person can do and follow to not get infected by a virus. And we can follow that our entire lives. It's not something that you should just do now. I mean, flu is a serious disease that kills many people. I've almost died from the flu. I got lung infection because I had the flu in the past. So I had serious pneumonia because of flu. So flu can kill people. Do we run around with masks because of flu? No, we don't. Maybe we should. Maybe we should ask him, are we going to start wearing masks for flu? That's the only way we can slow down the infection, Mkhize told Bingwa. He said he would be meeting with the Gauteng provincial government on Tuesday to discuss ways to fast-track preparations for the expected surge. So they're expecting a massive surge now. And you know, this is what happens every winter when people actually get flu. If in the future there is a need for another lockdown, we will not hesitate. Now, what is the need? What does that mean? The Ruperts and Rothschilds tell you to do it. The Oppenheimers. Is that your need? If the number of infections threaten the existing number of hospital beds that we have, obviously there will be a need for additional intervention and restrictions. You know, those comments are so vague that it means absolutely nothing. And this is coming from the health minister. If he actually made scientific sense in what he's saying, then one could discern what he's saying and actually judge based on that. But it's impossible to judge what he's saying because it's not based in any scientific fact. None whatsoever. It's just political speak. So I'm not sure what kind of doctor he is. Maybe one of you know, maybe one of you can actually comment. Thank you very much for those of you that have subscribed to the channel. The video that I released this morning, the call to action, has reached over 5,000 views and is growing rapidly. So I hope that in the follow-up videos on the call to action that you will follow those instructions and actually get going and starting in your communities and in your areas and do what is required to get rid of these people that we currently call our government. These servants that don't know how to serve, that are unqualified, that don't know what they're doing, and the mainstream media, we need to get rid of them first because they are absolutely buffooning most of the people out there, giving them absolute rubbish news. They are not journalists that go out and look for facts. They are just government mouthpieces. That's all they are. And they're just conveying it on a website. It's absolutely pathetic. It's really sad. But we will change that. One by one, we will give people the truth. We will give them the proper perspective with regards to the past and the future. And I thank you very much for watching this channel. For those of you that don't like to have a factual channel, there's many other channels out there that give entertainment. This is certainly not an entertainment channel. We have hundreds of people, probably thousands of people now on the ground actively working to help change this country. And that is what we need right now. We need people that are serious about affecting real change. We need the New World Order institutions stop dead in their tracks. And the first point of call is a new government system, new governance system, new electoral act. We need to get that change fast. And the first way to do that is to let people account for their actions up until now. Without accountability, there cannot be proper justice served. And justice will be served within South Africa. Till the next video.